Millie Day, welcome to the podcast.
Thank you for having me again, second time round.
So, yeah, the first time we discussed, you had a business, you were involved in a business that was about travel. Travel is a rehab alternative for people with addiction issues who needed help. And rather than going to rehab or going to other formal, traditional types of treatment, they could go with you on a traveling expedition, to Spain or to other areas of the world and get out of their environment. And it was an incredible idea, just that really resonated with a lot of people, even today, a lot of people listening back to that episode. And unfortunately, you were confronted with the biggest world war of all times, humanity
Hmm.
versus a virus, and all travel stopped. And I can imagine that it was probably impossible to keep that going at the time. And I know that now you have something new going on. So we're back again. And yeah, tell me all about it. Tell me what you're working on now.
Okay, so yeah, it was a real shame that I wasn't able to continue the recovery tracking because, as you probably gathered from the last podcast I did with you, I was so passionate about the idea. I just thought it was a brilliant idea. I thought it could have helped so many people. When I did the trek myself, I found it extremely therapeutic. It's that combination of being out in nature, the spiritual setting of the Camino de Santiago, being with other people in recovery, the connection. I thought it just made it the most wonderful program for recovery. But unfortunately, yeah, COVID came and sort of stole that away from us. Um, and I decided that I didn't want to just sit twiddling my thumbs waiting for something new to come along. So I decided to embark on a 3-year master's in dance and movement psychotherapy. So I think this is probably more widely recognized actually in the States than it is in other parts of the world. Here I say that's what I do, and people just often look at me with a kind of bewildered expression. Um, but anyway, it's a wonderful tool for healing. It's been especially, I found it to be especially effective for addicts. I've been working in a treatment center now since 2020. Actually, I managed to get work in 2020, which was quite remarkable. Um, I mean, I did actually reach out to quite a few other places. I probably sent about 60 emails in total. And one of the few places that responded with a yes um, was this treatment center in Wiltshire. So yeah, the sort of southwest of England. And I was amazed because everybody else had been saying, sorry, we're not accepting trainees because of COVID. But they gave me the opportunity, and it's just turned out to be such a success. I'm the first person to have done or to be doing dance and movement psychotherapy. I'm going to call it DMP because that's such a mouthful. So I'm the first person to be doing DMP at this rehab. Um, and I recently started working in another rehab, so I'm doing two. They're both very different, and yeah, it's just been really fascinating because I've seen such a transformation in people. And bear in mind, the first rehab where I started working, most clients aren't there for very long. Most clients are there for sort of 4 to 6 weeks, sometimes a bit longer, and they don't have to come to my sessions. Um, they have to do something in the afternoon, but they have a choice between DMP, creative writing, and exercise for well-being. So sometimes they come to mine, sometimes they go to something else, and so I don't necessarily see clients for a long period of time or over a long period of time. But even just within the space of an hour, I sometimes get the privilege of seeing them transform. Um, so as you can tell, I'm very passionate about this as well. um, yeah, and this is what I hope to be doing for the rest of my life. Not necessarily with addicts, although I do think it's particularly effective with them because a lot of the time in early recovery, people tend to be quite disconnected from their bodies. And I know from personal experience that, you know, people, myself included, spend a lot of time in their heads, especially if my program slips, if I am not practicing my recovery on a daily basis, I can really go into my head. And this is just a really wonderful way of connecting the mind and the body and helping people come out of their busy minds and into their bodies and listening to feelings as opposed to thoughts the entire time.
Yeah.
So, yeah.
It sounds great. Now, it seems like there's a lot of people that are don't do any kind of dance. They've never danced. I mean, there's people that are either introverted, shy, or maybe don't feel as connected to their body as other people do. Maybe people with certain mental health disorders where they, I don't know, possibly people on the autism spectrum. I don't know if I'm saying that right, the spectrum, but also, a variety of conditions, and people who may just have, there's a thing from brain injury, like we talked about before we started, people who have taken psych drugs or benzodiazepines for years, and they end up in a protracted withdrawal syndrome where they feel derealization, depersonalization, they feel disconnected from reality to some degree. And and maybe they're not comfortable with the idea of, I know me personally, it'd be like saying, throwing a cat in the pool. I'd be like, no way, I'm not going near a dance floor or a dance class or anything like that. But is this something like people who have absolutely no rhythm or sense of rhythm or dance can benefit from or get involved in?
Yeah, absolutely. I always say to people that really it's not about dancing as much as it is about connecting to the body. So I've had sessions where we spend the whole time seated or even lying down. And even breath is movement. We're moving the whole time. So it's not necessarily about jumping around the room, flailing your limbs and dancing in the conventional sense. It's much more about connecting to the body, identifying sensations, and then working with those sensations. And I say to people, there is no way you can get this wrong. It's not about being a good dancer. It's not about performing. It's
Yeah,
definitely not about looking aesthetically pleasing. It's much more about getting your needs met through movement. And that might mean not much movement at all. It might mean just sitting, hands on the body, breathing. I like to do a lot of self-touch to help people become aware of their bodies. Also, it's a good way if you find yourself going into your head just to come back into the body. And, most people, the vast majority of people come through the door saying, I feel nervous, I feel self-conscious, I feel anxious. Very few people come in sort of brimming with confidence.
yeah,
So my mantra has always been, safety and comfort, safety and comfort. How can I create a space where people feel safe, feel comfortable to express whatever they need to express, and not feel judged? And I also let people know that more often than not, the only people judging them are themselves. I don't see people looking at one another, judging each other. All that judgment comes from within, and it's towards the person, towards, yeah. The only people that we judge are ourselves most of the time. So I always say to people at the start, see if you can let go of some of that self-judgment. And that's often the hardest thing for people. And that's
yeah,
why people come in quite inhibited, quite reluctant to move. But that's at the start of the session. And usually by the end, you see something quite different. So over the course of the hour, I think the music obviously helps, and people bounce off one another's energy, and you just see people start to relax and enjoy themselves. And they're usually surprised by how much they enjoy themselves or how much they get. It's not necessarily about enjoyment, it's about getting something from the session. And so they might come in saying, I don't think this is for me, but my counselor's told me to give it a go. And by the end, they've kind of been surprised by how moved they've been, by their own experience or by the experience of the group. So it's really powerful stuff. People hear dance and they think, oh, it's just going to be, you know, I think they think it might be sort of something quite trivial, quite silly. And it can be silly, by the way. It can be silly. It can be childlike. That's part of the joy of it for me, is seeing people's inner child come out. But it can also be really profound work. You see people connect to, you know, um, emotions that have been deeply buried for so long. And I always say that all emotions are welcome in the space. So tears, tantrums. I encourage people to swear if that's what they want to do. I say there really are no rules. There is no right or wrong. And I give people that freedom, that choice. And I think, for addicts, that's so important, because freedom and choice are things that they tend to have lost.
yeah,
And a lot of people say that. They say that it's just so wonderful to have a space where they can just be themselves. They aren't restricted, they aren't inhibited, or, at least not by anybody other than themselves. And they can just be random, as one client put it. They can just move how they want to move or not move, and just be and enjoy that freedom, to, yeah, to just express themselves however they want to.
Yeah.
So
I think there, there must be something to it, like some, scientific basis, because I've never practiced Tai Chi or yoga or any of those kind of things, but if I pretend I'm doing one of them, even though I have no idea what I'm doing, like do some poses, put my arms in the air or something,
mm,
it changes the way I feel. I feel like I'm doing something that, I feel like I'm doing like a real thing, even if it's made up. Like there's actually a change of you know, I guess like mindset or frame of mind or feeling or perspective by, moving yourself around in space, kind of twirling around, putting your arms out in different ways and moving in different ways. Um, so now someone in their own room right now could try that. Like, oh, why don't I just stand up and move around and move my arms around, and even if I don't, no one's told me what to do, but I can just pretend I know what I'm doing. I'm not gonna hurt anything, it can't, it's harmless. Um, but I'm sure there's also some direction, that uh, like once you get beyond, you get a room full of people and now you tell them, feel comfortable, you can move in any way you want, whatever you're able to tolerate. What comes next, like what, as far as the therapy part of it?
well, so I don't start the session quite like that. What I would normally do is start with a warm up. So there is a structure. There's freedom, but there's a structure, and within that structure, people are free to move how they want. But I do start with a warm up, and I like to start with the feet simply because it's the furthest point from the busy chattering mind.
Yeah.
And I always stretch my feet in a particular way or move my feet in a particular way. And I say to clients, feel free to copy me or feel free to do your own thing with your feet. Listen to what your feet want. How do they want to move today? Notice how they're feeling. Notice what they're asking for. And a lot of the time, people do just copy what I'm doing, which is absolutely fine. And then we slowly move up the body until we get to the head. And then we do a little bit of shaking just to shake out any residual tension. Tapping is also a really good one just for bringing life into the body. And so once people have done the warm up, they're already feeling a little bit looser, a little bit more inclined to move. And they also have a better idea of how they're feeling. Once they've spent that bit of time connecting to their bodies, they have a clear idea of how they're feeling, on an emotional level. So then we do a check in. And I say to people, okay, so how are you feeling today? At this moment in time, not this morning or, any time before now, how are you feeling right now? And I ask them if there's anything they want to get from the session, if they have any goals or expectations. And it might be as simple as I'm feeling tense, I'd like to release some tension. Or it could be, I'm feeling so much confusion, I would like some clarity. It could be anything really. Again, there's no right or wrong with the check-in. And then once we do that, my job is not to tell people what to do or teach them anything. People so often refer to it as a dance class, and I always say this is not a class. I'm not a teacher. I'm a facilitator. I'm here to hold space for you. I do play music because I think without music it would be very hard for people to begin moving. I also let them know it's not about moving in time with the music. They're free to move however they want. I also let them know that music can bring up emotion, of course. And then really it's a process of self-discovery. So then my role is to observe. I carry on moving the whole time just so that I don't feel like a voyeur. My role is to observe and also to build relationships with people through movement. So I might go approach a person and start attuning to their movements. Mirroring is a very common technique in DMP, where you're essentially copying the person's movement. And that is a way of connecting with them, but it's also a way of validating their movements, showing them it's okay to move like this. You've got a right to move this way. It's okay. But as I say, every session is so totally different because it really depends what the person's bringing, what mood they're in, who's in the room, how many there are. Last week, I had a session of 5 men, and one of them had been before and the others hadn't, and they were you could see it in their bodies, they were very bound, quite rigid, and so if I just said, right, do what you want, I think they'd have all just frozen. So in those situations, sometimes it helps to be a bit more directive. And one of these clients just was throwing an orange up and down in the air. He must have had an orange in his coat pocket or something. So I suggested we pass the orange round in a circle. And then it turned into a game of piggy in the middle. And then the whole session was just one big game of piggy in the middle. Firstly with an orange, which then broke, so we had to use an apple, which then also broke. So there were bits of fruit going everywhere. But that was quite funny. I think that, I think they appreciated the sort of freedom just to throw fruit around. And in the end, we did use a normal ball. But by the end, they looked so much more relaxed. One of them in particular, just looked so much more relaxed, and his whole face had softened. His whole demeanor was just completely different to how it was at the start. So you might listen to that and think, well, that doesn't sound like therapy, but actually, for those clients, they said to me later on, how much they had enjoyed it and how much they'd got from it, just because they were given that freedom to mess about, to be silly, to let their inner child out, and to get some exercise at the same time. So yeah, I mean, not every session is about piggy in the middle with fruit, but
Yeah.
and then I had actually also done a one-to-one that morning, so I do one-to-ones as well. And I'd done a one-to-one with one of the men who was in that group, and the one-to-one, he was in a very different headspace. It was very solemn. It was quite heavy. He didn't want to get out of his chair. Every time we tried connecting to the body, he would start going back into his head, and kind of I think he was struggling to really stay present with his feelings. But then I saw a totally different person in the group session that afternoon when we were with those other men playing that game. So yeah, it varies so much depending on who's there, um, what people are bringing, and so the therapy is going to be different each time. But and that's what's so. I mean, at first that's what terrified me about it, but now that's what I love about it. You just never know what to expect. You never know what to expect. You can't plan for it. You can't predict it. I couldn't even tell you what a kind of typical DMP session looks like, because every single one is totally different, besides that structure that I was describing. And then towards the end of the session, once we've had about 45 minutes or so, freestyle movement, we then come to a close with some verbal reflections. So we just share our experience of the session, what it was like. I'll ask clients, did you manage to achieve your goal? If they'd set one. Sometimes they prefer not to. And that's just a good way of processing and making sense of the experience before we go into a final checkout. And then, yeah, and then they carry on with the rest of their day. But I love it, because at the beginning I felt like I was having to sell this to people, constantly try and get people to come along to my sessions. But now what I've noticed happen is people come along and they love it, and then they kind of act as an ambassador for me. So they go around the house saying, oh, you must go to one of Millie's sessions next week, you must try DMP, it's not what you think. And yeah, I obviously appreciate that.
Yeah. When you talk, you had mentioned that I think that people, that the trauma or feelings or emotions come out, and some people, some experts believe that all addiction is rooted in trauma, that there's
Mm.
some trauma that led to the addiction. And then in yoga, they say that, trauma is stored in certain muscles, like the psoas muscle.
Yeah.
And I think there's another form of yoga where it's stored in the spine. And so it makes sense by doing movement that you could free up trauma, that you could bring out those feelings and emotions that are trapped, and just feel like you've kind of gotten them out. I mean, can you talk about that a little bit?
Yeah, definitely. I mean, I think trauma can get stored in various different parts of the body, and for each person, it's going to be a little bit different, which is why I don't stand there saying this is how you should move. Each person is going to move in a way that's right for them, and it's instinctive. So you're not going to think, right, my trauma's stored here, therefore I'll move this part of my body. The body knows what to do. There's this fantastic book called The Body Keeps the Score, which is all about trauma and the body. So the body naturally knows what to do, and I think it's really helpful. Yeah, I think it's really helpful for anybody that's endured trauma, because a lot of the time trauma, it's not linear and it's fragmented and it's very hard to make sense of. And when you speak about it, it's hard to make sense in words, whereas movement can offer a different way of processing the trauma and a different way of expressing it. I had one doctor actually who had worked on the COVID wards, you know, in 2020, and he was so traumatized from all the deaths he'd experienced. And you could see the way he was holding it in his body, again, very bound, very rigid. and he would come along to the sessions, and he was someone who was quite comfortable with movement, so he wasn't particularly inhibited. In fact, he wasn't inhibited at all, and he really did just let his body do the talking. And by the end, he would just say, wow, I feel like I've had such a powerful release. And then when he left, he told me that those classes, or I'm now calling them classes, those sessions had given him the opportunity to express what he was unable to express in words. So, he'd been through all this horrific trauma. He really couldn't open up about it in group therapy. He tried, and apparently every time he tried, he'd just sort of freeze. But he wouldn't freeze in the DMP sessions. He would move, and it was like the trauma was coming out through movement as opposed to words. But words are also a big part of DMP. I do encourage people to speak if they feel comfortable doing so. I invite them to keep it relevant to what's happening in the here and now. So not to speak about what they're going to do post-treatment or what they're going to have for dinner or anything like that, but to just keep it really relevant to their experience in the moment. And yeah, no, I think it's probably most effective for people who have had trauma. But as you say, a lot of people, when they've been traumatized, they are afraid to connect to the body. They're afraid of what they might feel, what they might experience. So you have to tread very gently. You have to kind of approach things carefully, and because you don't want that person to be re-traumatized. But again, I think the body will never give more than what that person is capable of doing on one particular day. So I think if somebody isn't ready to process all that trauma, then they won't move quite as freely as, for example, this doctor. But yeah, like I said, it's really all about letting the body do the talking. And I say to people, be easy on yourselves. Don't push yourselves. This isn't an exercise class. This isn't about, strenuous activity. This is really about just listening to your body. And it can be a really powerful release, but it's not necessarily about that either. Because I think some people think, oh, I'm in here now, I have to let go, I have to have this release, I have to, jump around and let go of all my tension, and actually it's not necessarily about that. So I invite people to let go of all expectations, just to come in, see what happens. Not to, obviously it's good to have a goal or an aim, but not to be disappointed if they don't get what they were expecting to get, because you never know what you're going to get. But I always think that the experience that you get is the right one for you, and that's what I tell people.
The doctor that you were working with was a doctor trying to overcome an addiction to alcohol or another drug?
Alcohol, yeah, yeah.
Okay. Which is pretty common. That I mean, there's a lot of mental health issues with doctors, and they can't talk about it because they're terrified of being disciplined just for having a mental health issue. So there's doctors that are suicidal. The suicide rate for doctors is much higher than the general population. Probably the alcoholism and addiction rate is much higher. Have you worked
Mm.
with other healthcare professionals?
So many, yeah, we get
Oh, wow.
so many. Yeah, and they find it very hard to let go of their identity as a doctor or as a healthcare
Yeah,
professional. A lot of them come in, and they continue playing, or they try to continue playing the doctor throughout their time in treatment.
yeah,
And I think a lot of them are just terrified of letting go of that identity because they don't know who they are beneath it. I mean, that's not just the case for doctors, but it seems to be especially common in doctors,
yeah,
that they are just terrified of getting to know who they are, underneath that identity of being a doctor.
yeah.
Yeah.
I wonder if it might be easier in England uh, for a doctor to get help, because I know in the US you probably almost never see a doctor in rehab. They're more likely to destroy their career with their addiction and kill themselves. I mean, there are some, but when you go to like these recovery groups for doctors, you don't see too many of them there, and they kind of really keep it, just that their their careers are like just really destroyed, or they get put into these disciplinary programs where it's almost impossible to function and get out of again, or maybe it's just a social thing that they just don't want to get help, and because they don't want to go through that process. I mean, I don't know.
Mm.
It could be the same where you are. I'm not sure.
Well, I mean, we've seen so many doctors at Clouds. I've worked with a lot of doctors, so I mean, what you're saying actually makes me feel really sad. About how
Yeah.
many of them don't get help; they just go on to destroy their lives. I don't think it's quite the same in the UK. We do also have meetings. There are AA meetings and probably NA meetings as well that are specifically for doctors and dentists.
Oh, wow.
Yeah. I don't know much about those, but there's certainly, I mean, it might be that in a lot of cases they get sent, by their employer. I
Yeah.
think a lot of the time the doctors that we get don't necessarily want to be there.
Yeah.
they've been ordered to come in, but that's not always the case. But yeah, no, I've seen so many in treatment, so many, probably possibly more healthcare professionals than you know, any other
Yeah.
professional.
Well, it's great that they're getting help and
Yeah,
getting a chance to interact with you and have access to this kind of therapy. Um,
yeah,
when when you were talking about that not everything can be expressed verbally, it makes a lot of sense because there's a lot, the brain is not, verbal. I mean, a part of our brain is verbal, but there's so much more to it. Like I was imagining like someone playing like a big piano concerto. Like I like watching on YouTube these people playing the Prokofiev Third Piano Concerto because it's really incredible and beautiful. But there's no way that these pianists are sitting there going, okay, A, F sharp, B. I mean, they're playing so fast and up and down the keyboard with octaves and scales and stuff. I mean, that's all stored in their fingers. And I mean, I know it's coming from their brain, but there's nothing verbal about that. And
yeah.
so you can imagine the complexity of communication and expressiveness that has nothing to do with verbal communication. It completely makes sense that movement therapy would be something really important beyond talk therapy.
Yeah, definitely. A lot of people just find it really hard, whether they've been trauma, whether they've had trauma or not. A lot of people just find it very hard to express themselves in words. A lot of people find that they can express feelings more effectively through movement or perhaps through art or through drama or music. I think I'm one of those people. I find it a lot easier to express myself through dance and movement than I do through words. Especially since having COVID, I really feel like I had such bad brain fog during COVID, and I'm not sure if my brain's actually fully recovered, but my body's fine, So I can really empathize with anybody that struggles to express themselves in words. Um, and also, like I said, it's hard to sometimes know how you're feeling. And when I used to do the check-in at the start of those sessions and ask people how they were feeling, they'd often look at me like a rabbit in the headlights. But once we'd done that warm up, once we'd spent a bit of time connecting to the body, they tended to have a clearer idea of how they felt. So when they're sitting there in group therapy in the morning and they're just expected to talk for an hour and a half about their feelings, I get why they find it hard because a lot of them don't know how they feel. A lot of addicts in early recovery are so shut off from their feelings. But once you begin to connect with the body and engage with sensations in the body, then you start to understand how you feel. And then you can express those feelings either through words or through movement or both. And actually, I like to do all kinds of creative things in my sessions. I've had instruments in there before. I've brought in props. I've brought in, paper and pens because although it's dance and movement, I actually think whatever works for you, this can be a creative session. So it doesn't necessarily have to involve just dancing and moving. It can be a bit of art, a bit of music, a bit of drama, whatever you
Yeah.
want it to be, really. Whatever helps you connect to your body, whatever helps you um, understand yourself better and express yourself more easily. And that's another thing that I love about it. It's so non-prescriptive. It's really just how can you help, how can you empower this client? How can you enable this client to get their needs met? And really, that's why I ended up playing Piggy in the middle with fruit last week, because that's what those clients appeared to need in that moment of time. I think if I'd told my team that that's what I'd been doing, they might not have been so impressed. But you know what? Sometimes you have to break the rules.
Yeah. And addiction is a really difficult thing that and I think this is why people who are very intelligent and creative tend to get caught up in addiction worse, and that's why you see a lot of really high functioning people that try who really, and I think they have the hardest time getting into recovery because their best resources of what their brain can do work against them. Like if you're a really smart creative person, you're gonna you have this addiction thing riding your brain, pulling the strings, saying, okay, you know how to find your way out of this one, and say whatever you have to say to get us back to the drug again. And I always thought, like, if you take this big empty mansion and you hide the drugs or alcohol somewhere, like in a shelf of a closet off in a distant room, and you put the person in front of the door and say, okay, go see if you can go find the drugs, they'll probably just say, like, I don't even have to go look. I'll tell you exactly where they are because I figured out where you're going to hide them already. Yeah, I mean, the people just, they just become like these brilliant geniuses when it comes to like following their addiction. So now people in that situation have a really hard time recovering. But there's parts of the brain, I think, or parts of us that are not accessible to addiction. Like that's why spirituality works so well, because
Yeah.
that's kind of walled off. That's like a safe space. Addiction can't cross in there. Just like a vampire can't go in a church or whatever. As soon as
Mm.
it becomes a spiritual situation, you're safe. The addiction is outside waiting, like they say in meetings. And I think maybe same thing with movement. It sounds like something that, humor, social connection, communication, and being noticed. I mean, that's another thing, like a person with addiction might feel completely alone. They could even walk into a meeting where people are talking, and like, I hate talking. I don't even want to be a part of this. Seems like they're all friends and they're all talking and no one's looking at me. And so the meeting does nothing for them. They isolate, talk themselves out of it. But it seems like you have something going on that also, like spirituality, gets around the addiction. It makes it
Yeah.
possible for a person to recover.
Yeah, well, I think dance movement, I think that is spiritual. I think that is you gain access to your spirit through dance, through movement, because things that are deeply buried in your subconscious come out through the movement. So you aren't thinking about it, you're feeling into it. So for me, it's always been a very spiritual thing, dance and movement. But yeah, what you were saying just then about somebody walking into a meeting and not being noticed, and so the meeting, doesn't work for them so well, that just reminded me of a client that I've been working with recently who absolutely despised group therapy and meetings and any other kind of group where it was all just about speaking, because she'd had quite a bad brain injury and it took her a long time to process what other people were saying and to think about she wanted to say in response. And by the time she'd finally figured out how she was going to word it, you know, things had moved on. So she would get so frustrated with herself. She'd come out crying. Um, I really, really felt for her because I could see how angry she was towards herself. And yet this wasn't her fault. She'd had a really nasty brain injury. Um, one week her counselor suggested she came to DMP, and she did, and I just saw a completely different side of her. She was obviously a bit reluctant to come in, a bit hesitant initially. um I saw her smile, I saw her connect to others, her body just seemed to know exactly what to do, and again, one of those complete transformations. And later on, clients write journals which we read because it's another way of them communicating with us. And she wrote that she had had a breakthrough in that session, that she'd found something, she'd found an outlet, that she didn't know that she had access to. And she said that later on, when she was, because she had this real thing about people not noticing her, not seeing her, not hearing her. And yet when you would ask her a question in a group, she'd freeze and she'd say, please don't talk to me, I don't want to be picked on, were often her words. So it was hard to help her because she seemed to sort of be begging for attention, but at the same time rejecting it. Anyway, in the session, she had this breakthrough. And then later on, she'd written in her journal that when she was sitting with the other clients in the living room, she didn't feel like she wasn't being heard. She didn't feel like she wasn't being paid attention to. She just felt comfortable, relaxed, and content. And when I read this, I just thought, oh my gosh, yes. I mean, it didn't, there were ups and downs. Sometimes she'd come to sessions and she'd leave crying, and it was, she had she was quite a temperamental individual, and so not always so easy to work with. But I was so pleased that she had found something that worked for her. And actually the art really worked for her as well, because she's someone who struggles cognitively but is clearly able to engage in creative means of expression. So the art and the DMP worked really well for her.
Oh, well, that's an incredible story, incredible case.
Yeah.
And it does bring me back to that thought of, like, in any kind of group meeting or group situation, whether it's an addiction meeting or any kind of meeting, there's always those people that dominate the group verbally. They're just talkative people. They're good talkers. I don't know if it's a right brain, left brain thing or what it is, but and that's definitely not me. If I'm sitting there and people are talking, I'm just going to sit there and listen. And maybe if I had something to say, maybe I'll go and write it later. I'm not going to try to break into the group and say I've got something to say, because I'll probably at the time think like what I have to say sounds really stupid or embarrassing, or let me just let them talk because they sound a lot better than I do.
Yeah, snap. I do that too.
Yeah, yeah. So you have all these. So now you have like the people getting all the benefits supposedly of the recovery, that are just talking and talking, getting all their thoughts and feelings out, and just kind of hijacking the group. But what you're doing, that's it's completely flipped around. I mean, I don't know if anybody could really dominate a dance group. I mean, they can go off and do some flashy dance moves, but who cares? Because we're all doing our own thing. And
Exactly.
so um, yeah, it sounds incredible. That because I think people are terrified to go to rehab in some cases because they're like, I'm just going to sit there all day in these circle groups of these annoying people that just keep talking and talking, and I just can't take any more of that. But to think that there's something different, something that might be better for a lot of people is great.
Yeah. Yeah. And I think also when people talk, this is why, before we started, I was saying I think it's great that you put these videos on YouTube, because when you watch a podcast, you can see so much of what's not being said. You can see the expressions on people's faces, people's body language, which I think says so much more. So often in groups, talking groups, somebody might be saying something, but their body's saying something completely different, because the body doesn't lie. The head can lie, the mouth can lie, but the body does not lie. And that's what I've noticed in DMP. Someone might come in and they'll say, I'm absolutely fine, I'm having a great day. And it's just it's just like, well, clearly you're not, because you're standing like this, you're tense as anything, and you're saying one thing, but your body's just suggesting something totally different. So yeah, I think it's a way of people can be a lot, well, people are a lot more authentic in movement than they are um in talking groups, I find.
Do you think this kind of therapy is something that could be useful or accessible, like over video, like either in a live video meeting or even
Yeah,
pre-recorded?
yeah. Do you know what, you actually earlier in the interview, you mentioned autism, or people on the autistic spectrum, and I actually, my very first placement was with children on the autistic spectrum, which we had to move from. I think it was, one of the many lockdowns. We had to move from in-person sessions to online sessions, and I thought, this is never going to work in a million years. I really didn't have much hope. It's quite hard to contain these children when the sessions are in person. And I thought, they're now in their own homes, they're going to get distracted. How is this going to work? But actually it did kind of work. I mean, it was totally different. You couldn't go in with the same expectations, but it does work, and it's now the way that a lot of people practice. I've got a friend who was on my master's. She ended up moving abroad, and she's done a lot of online work. And I think personally, I'd always rather be in a studio, or be face to face. But I know that for a lot of people, it's preferable to work online, or maybe it's not possible to work face to face. I think there are probably advantages and disadvantages to both, but yeah, it definitely can work more so than you'd perhaps think. I mean,
Yeah.
people even do it over the phone. My tutor, when we were when I was studying, she would say that she's had some of her most powerful sessions just over the phone, which again I can't imagine, but there we go.
Yeah. Yeah. And also I was thinking of, this is something that I think would be greatly beneficial to, like we had discussed before, people with other brain injury issues,
Mm,
like what they call toxic encephalopathy, people that have been injured by taking maybe antidepressants for a long time and maybe they weren't tapered off properly, or people that have been injured by benzodiazepines, which we now know are much more toxic to the brain than anyone ever thought they were. We used to think these are
mm,
totally safe because they don't kill people, but there's damage that can be caused without killing a person.
yeah.
So the benzos we now know in the last couple of years are highly toxic, and people get stuck with these protracted withdrawal syndromes, and they in most cases with the benzo issue, there's no addiction whatsoever. It's all, I mean, sometimes family members might think there's an addiction issue and there's not. You know, they sometimes they get sent to compulsory rehab. They're forced into rehab. They're forced into treatment. They're forced to do things that are meant for people with addictions when they don't have an addiction. They're just
Mm,
suffering with a horrible brain thing going on where they have intestinal symptoms. You know, some people call it benzo belly, where they can't eat, they have gas and bloating and all these other things. They have increased histamine sensitivity, where they have horrible allergy symptoms. And then the worst is akathisia, which is a movement disorder. And that, I think it almost seems like that might benefit from movement therapy, where akathisia is where a person can't sit still. Literally, the word means that they can't sit. They walk around moving their arms and walking around, pacing around, and it's a horribly uncomfortable thing. Some people describe it as like an inner pain where they can't say where the pain is, but it's horribly painful. And some people say that they just want to claw their skin off and peel their skin away. It's just so uncomfortable. And there's people that have suffered with it for years at a time, and then they overcome it. But it's often a cause of, causes suicidal thoughts, because it seems like there's no way out, no escape, no treatment. But one therapy that I always thought was interesting is controlled aggression, where a person can beat their pillow, or put their scream into their
mm,
pillow really loud. And they say with controlled aggression, you want to let other people know, I'm going to do this because you don't want them to think you're hurting yourself, or there's a
mm,
problem. But you can like scream into your pillow, or scream as loud as you can, or punch a punching bag, or
mm,
one of those karate dummies that you can punch, or something like that, not
yeah,
a real person. But so that kind of reminded me of, like, maybe there's some connection. Maybe people with these protracted withdrawal syndromes might benefit. In a lot of cases, they don't even want to get out of bed. They don't want to even think about moving. They just want to be left alone, which might be
yeah,
the worst thing for them. Maybe in a lot of cases, they need to get out. They need to walk a little bit, get out the fresh air. But,
yeah,
but maybe with akathisia, even, maybe, something to help them burn the energy off. They say that
yeah,
helps. Um, so it seems like that there could be a connection there. People with these other conditions that are not necessarily, and people with addiction, we should also recognize they have brain injury too. They probably also almost certainly have toxic encephalopathy. Their brains have been injured by chemicals. The difference is, whether, someone might say, well, you chose that way, that, this is different. It's not really different.
mm,
I mean, it's like, um, these chemicals damage the brain, and then, and addiction is not, it's a health condition. It's a
yeah,
mental health issue. It's not a person's fault once they're caught up in addiction. It's like maybe
yeah,
it's inherited, but these different groups are in the same situation. Um,
yeah, definitely.
oh, let me,
I
yeah,
Yeah, I haven't come across anyone with any of those conditions that you mentioned, which by the way all sound horrific,
yeah,
horrific. But we do a lot of I've never referred to it as controlled aggression, but I guess catharsis in sessions where, people do just scream, shout, punch the air, punch pillows, or obviously, it's safe. I don't I don't allow
yeah,
people to punch each other, or the window or the wall or anything, But I think catharsis can be really useful. But on the flip side, sometimes I've noticed it can also wind people up more. It can kind of rile them up, further. And a lot of my sessions, I'd say the sort of the kind of the core of what DMP is about is acceptance, accepting what's happening in the body, not judging it. It's really easy for me to say that as someone who's quite healthy and isn't experiencing a lot of pain, isn't experiencing any of these nasty conditions that you described. But if I were to work with someone like that, I guess my job would be helping them befriend their body, helping them accept and learn to be with what they're experiencing, as opposed to fighting it or trying to get rid of it, or trying to. But again, it's so easy for me to say that. I'm aware because I'm not experiencing the kind of pain that they are.
yeah,
But I have other things that I don't like about the way I feel. Well, I often experience feelings that I don't want to feel.
yeah,
And it's what recovery is, isn't it? Recovery is very much about feeling those feelings, being with those feelings, accepting those feelings. And that's another reason why I think DMP ties in so well with recovery and is so great for addicts, because it does teach them to be okay with their feelings. And I've had many sessions where we just sit and we just talk about what's going on in the body. So a client might come in and say, I'm really anxious. I've had this call from my wife and she's threatening to divorce me, or whatever it might be. And rather than getting kind of fixated on the narrative, I'll say, okay, what's happening in your body right now? And they'll say, oh God, I've got butterflies in my tummy. And I'll say, okay, let's just be with those butterflies for a bit, shall we? And as you know, I'm sure you're probably aware, once you sit with the feelings do eventually pass. I know obviously that's not the case when you're in a lot of pain, but fighting the pain, fighting those feelings is of course only going to make it worse. So I'm a big advocate for catharsis, but I also think sometimes just the simple act of sitting and trying to be with and accept what's happening, what you're experiencing, even if it is really nasty and uncomfortable. It's simple, but it's powerful.
And I would imagine also, and you probably have worked with patients in these situations, other conditions like, and things that are often associated with, you have these groups of conditions that are, in fact, now that they're talking about all these different psychedelic therapies, they have a list of standard
Mm,
conditions that seem to respond, and addiction is one, but then there's also chronic pain, depression, anxiety,
yeah,
obsessive compulsive disorder, post-traumatic stress disorder, um, I know migraines would help, but migraines are usually thrown into that group. Um,
yeah,
just this collection of 9 or 12. There's a list of different conditions that always seem to get grouped together, that, along with addiction. And
fibromyalgia, isn't that another one?
yeah, that would be, yeah, probably a subcategory under chronic pain, but yeah, definitely
Right.
fibromyalgia. Um, and that is that complex regional pain syndrome, which used to be
Mm,
called RSD, but yeah, I mean, like I was thinking OCD, because I get those kind of OCD things of like, check the door, make sure it's locked, then like, well, let me check it 3 times, let me check it a multiple of 12,
yeah,
or
yeah,
something, like you get caught up in these thoughts, which I think is similar to the it's another kind of movement disorder. Your brain just feels like you just can't, you don't feel comfortable until you've done this thing, and now you feel bad about it. And I feel like somehow what you're doing would help with that.
yeah. Do you know, I've never really thought about the benefits for people with OCD, but I think you're right. I think I've got a bit of OCD actually. I'm always doing things like I'm always straightening out my, I haven't actually
Yeah.
done it. I've managed to resist doing it so far in this interview, but my boyfriend always takes the piss out of me for pushing back my eyebrows like all the time. But again, I think, I do that when I'm in my head. I do, I have these OCD tendencies which tend to kind of come out or be worse when I'm in my head. When I'm in my body, that doesn't happen. So again, simply by connecting to the body and being with what's going on in the body rather than attaching to the thoughts, I think, yeah, I think that can be a huge help for people with OCD. But as of yet, I've not actually worked with anyone with OCD, at least not to my knowledge. No one's ever brought that to a session. But yeah, I think just that simple act of connecting to the body could definitely help.
Yeah, I imagine, like, probably not now, but like in the distant future, once they've figured out how all these psychedelic things work, and how they
Yeah,
can actually be used therapeutically, that there might be a connection there. That right now, the idea is that someone takes a certain amount of psilocybin or MDMA, in a controlled setting with a therapist, but it's always a talk therapist. And I'm like, well, why talk therapist?
yeah,
Why not a movement therapist?
yeah,
Um, so that there could be like a, maybe, and then maybe that needs to be studied. They're doing all these studies now with these things, and there's ayahuasca and I mean, maybe some of them people aren't able to move during the treatment, but definitely some of them, and maybe limited movement at least. If it's not getting up and dancing around, at least moving the arms, and
yeah,
I think it
definitely.
definitely needs to be part of that.
I agree. I'd never again never thought about that, but definitely because also, like I say, when you're moving, it's not just moving. Words come with that, so it's incorporating everything. It's incorporating movement, words, noises, um, and yeah, I think that could be extremely helpful for people, going through that. So yeah, okay, maybe that'll be my next project.
Yeah, yeah, definitely. So anyway, yeah, let me, I don't want to keep you all day here. Let me wrap this up. And I really appreciate you joining me. I mean, this has been a really, really didn't know what to expect in talking about this. I've learned a lot, and I think it's a really
Great.
intriguing therapy, and it's important, especially therapies that don't have side effects and adverse reactions like medical, drug therapies.
Yeah.
Um, there's really no downside, and it can
No.
really, it sounds like it can really work well with a lot of other therapies, like another one I like was aromatherapy. aromatherapy, there's sound therapy. There's
Mm,
so many great things that are proven to be effective,
yeah,
and and they're not harmful at all. So
yeah, yeah. And I have to say, I'm really lucky working at this particular rehab because they offer all of those things that you just mentioned.
oh wow.
And you see the clients benefit because they're being given what they need. There's something for everybody there. And so clients that struggle with one thing will get their needs met in a different way. They'll struggle with talking therapy, for example, but then they'll be able to express themselves through art or through movement or you know playing music. I'm a big advocate for all of these alternative therapies. I wish we wouldn't even call them alternative. I think they should be mainstream. I think everybody should be doing them all. I think we should all be doing, exploring the different therapies and finding what works for us.
I had I'll just say one more thing. I had an idea for a therapy that I don't know if anyone else has done this, but if you've ever played with like music software, they have like you can do or a drum machine, and it has a quantizing feature where when you play, it puts it in rhythm for you. Like even if you're off in rhythm, it'll line it up in like 16th notes, and there's software that'll loop through like one or two measures, and you just keep hitting the drum pads, and it adds whatever you
Mm.
hit to the measures. As it loops, you hear what you just played, and you can add to it and keep adding to it, and it quantizes it. So even if your rhythm's bad, it fixes it. And I always
Oh,
imagine
really?
like, yeah, so I thought like, what if you set up this software and then maybe some actual drum pads, like a drum set that's electronic, and then people can sit down and they have no rhythm or drum talent whatsoever, and they can sit there and just keep adding stuff, and they're like, wow, that sounds
Yeah.
really good. And then, now they've created these incredible rhythms that, I don't know, that's like one of my, I imagine if I ever like suddenly had $1 billion that I could make my own rehab center, I would definitely have the drum room.
Yeah. No, that's really cool. Although I have to say, when I talk to people when they come in and they're feeling a bit anxious because they don't think they're very good, they don't have a talent, so to speak, I always, I wish in this country we were less fixated on being good at things and being skilled and just and enjoying them for what they are rather than for what we can, you know, enjoying the process rather than the outcome. Because I would say, I'm not particularly musical. I'm certainly not very good at art, but all these things can still be useful to me because I can still use them as a way to express myself. So I love what you're saying, but at the same time, I think even if it doesn't sound good, it's still effective because people are still getting something from the process of drumming, or they're still getting something from the process of
Yeah.
making music, no matter how it sounds. How it sounds is kind of irrelevant, in my opinion. What the person's dancing looks like is irrelevant. What the person's artwork looks like is irrelevant. It's about the process. It's about how you feel as you're engaging in that particular creative activity. And I think actually being really skilled at something can almost hold you back because you then feel frustrated if you're not able to produce a particular piece of art, for example, or a particular piece of music. Um, and people who come into DMP sessions having already done some sort of training, I think they tend to kind of resort to the moves that they know because that's what they're used to doing, that's how they're used to moving, rather than actually listening, really listening to their body and moving in more random ways, perhaps. Does that make sense?
Yeah, that makes sense. Yeah, maybe my idea is like going off track as far as like, yeah, if you like have the computer fixing the rhythms and like, it's not really what you actually played, and maybe you're right, it's more about, you know, expressing yourself and expressing your feelings and letting your body do what it needs to do, rather than hearing some artificial fixed up version of it coming back at you.
Yeah, because then it's not really from you. It's not really from it's yeah, it's artificial. So it might sound nice, it might
Yeah,
be more pleasing on the ear, but then it's not really your own creation. I mean,
yeah,
this course that I was the reason that my name was Millie Assistant before we started this podcast was because I'd been co-facilitating this course and it was absolutely brilliant. In fact, this should be your next guest, the woman who the main facilitator of this course. It's called Life Art, and it's for people in recovery. It doesn't have to be 12-step recovery, but people in recovery from any addiction. So it can be alcohol, drugs, sex, gambling, food, whatever. And each week we'd explore a different theme. So it might be acceptance or surrender or forgiveness or love or whatever. And we'd explore that theme creatively. So we'd do some movement, we'd do some artwork, we'd do some poetry, or some other form of writing. And a lot of the time the most powerful images, because we'd often show our images, show our artwork, read out our poems, And the most powerful ones were not the ones that were technically good, but the ones that you could just tell there was so much meaning behind them. You know, the emotion had come out in the picture or in the piece of writing. And so I think it's hard for people to let go of that idea of producing something that's kind of perfect, but instead just to let, you know, let whatever is inside them come out in this work. And you know, I like I say, I'm not arty, but my drawings, my pictures, they had meaning. There was meaning in those pictures. Um, so yeah, I think I'm probably waffling on a bit now, but you get what I'm trying to say.
Oh yeah, yeah. It's like and I was just having this conversation with someone the other day that when a band that that you like, when you hear like your favorite hit song, a lot of times like the big hit songs are the ones that they like threw together like in a day. It's like,
Yeah,
we need to fill 3 minutes on this album. Let's quickly get a song done and write
yeah,
it. It's never the ones that they really planned out and thought out. Those are like the ones that the one they thought was going to be the hit doesn't make it, and the one that they just did by feeling really quickly, like maybe like in a minute somebody quickly wrote the music and the words. So yeah, I
yeah,
mean the things that are just coming naturally, like our real feelings and real
yeah,
expressions, that's what's valuable, and that's what's really the art.
totally. I totally agree with
So okay, Millie Day, thank you very much
that.
for joining me today.
Thank you for having me. It's been great.
Thank you.